All right, thank you. Well, I welcome the opportunity to talk about our healthcare plan and the future we have within the DHB. Sad fact of life that healthcare is changing. Certainly when I was starting off as a young doctor, ladies stayed in hospital for 2 weeks when they had babies. You had cartilage trouble with your knees, it was a week in hospital. You had your appendix out, it was 4 or 5 days in hospital. Now things have changed. When you have a baby, it's 1 or 2 days, perhaps not even 1 day in hospital. With various technologies, we've reduced certainly the stay time post-operatively by many days in a lot of procedures that we do. This has come at a cost in that although that we can move patients through much more quickly, the fact we're doing more patients and using much more costly technology does come with some risk to us. So healthcare is changing. It's changing, we're sure, for the better, but that brings challenges to us as a DHB, and the way we respond to those challenges is very important. No matter how much we think or value the work that we do, we have to understand there's not an endless pot of money at the end of a mythical rainbow that we can keep on going back to help us cope with a situation that, although it's fascinating and marvellous in terms of the technological point of view, is becoming more costly to run. So we can't afford to keep on doing the things that we've done just because we've done them before and that's worked in the past. So we certainly have to change. We have to find ways to deliver the same high quality healthcare but do it more efficiently and particularly much more cost effectively than perhaps we are currently doing it. This means a much wider integration with primary care. I think for too long that the hospital is seen as where medicine takes place, when in actual fact we in the health profession know that most of the medicine happens outside the doors of the hospital. It's much more cost effective if we can prevent patients from coming in, prevent them from coming in not from the point of view we don't want to see them or we don't want to treat them, but we know it's a much more efficient for the patient, but also better for the patient to be treated in the home environment if possible. That does mean, of course, we have to put in supportive networks for that to occur, and that needs planning between the primary, secondary and tertiary care sector. So we've got to think about the ways that we deliver health in the future, and change is challenging. Change is challenging both for the health professionals but also for the public and also for people in all sectors in health. And so we have to work our way through that change. As I've said before, too long I think people and patients have equated health to hospital, and if you recommend, for example, that a hospital is replaced with a, say, integrated family care unit, for example, which is a much better way to deliver health, the fact that the hospital is there no longer, people will find challenging to accept as a step forward or as a way that health will be better delivered. It's important we talk about this because we have to discuss it. Health is not something that happens in isolation. It involves the whole community. All sectors of the community need to be involved. And so the healthcare plan that a tremendous amount of work has gone into producing must be widely debated. We won't always agree, there'll be disagreements, but that's not unhealthy. Out of healthy debate comes healthy solutions. I think it's important, though, that we all go into this with an open mind. Clearly we have our own priorities and perhaps sometimes our own agendas that we wish to push, and health professionals are not always good at looking beyond their own siloed endeavours, but we have to do that, and we have to take a much more global outlook as to what is best not only for the patient but for the DHB, and what is best to keep on ensure that we can delivering high quality healthcare within the resources that we have been given. That's a challenge. But to start that debate we have to have a well thought out and robust plan. We think we have that. Public consultation and further debate will test that, but we have a good robust plan around which to hang ideas and new ways of doing things, and I think the future outlook is good, not only for the patient but for the DHB, and I think overall for the health sector within the region.